Well, the management of drug shortages, as well as specifically IV fluids, is something that should be in the minds of pharmacy leaders. So I think utilization of your resources and making plans, and not necessarily stockpiling, but making plans to have effective practices in place such that you're not overutilizing resources is important. So I think, first of all, review the use of parenterals in your institution and specifically IV products. I think a good place to start might be in the intensive care units. And a lot of times we use these for delivery mechanisms for other drugs, or a lot of times we don't give it thought to how much and how IV fluids are used. So perhaps some review is necessary there. I think also moving patients over to IV, from moving from IV to PO mechanism, so moving people to oral drug therapy would be an important step in control of your IV fluids, as well as perhaps drugs can be given IV push versus IV infusion. There are many drugs that can be given by IV push route, and over time, generally, we have migrated towards putting them in fluids to be delivered. But I think that's another way that we can reduce our dependency on IV fluid utilization. We should also have sound inventory practices that really result in effective utilization of those IV fluids, reducing obsolescence, making sure we have appropriate turns of those inventories, and not places in which they are stocked but not being utilized. Overall, I think IV fluid stewardship is something that each health system should consider and develop a team to kind of look at its use of IV fluids and improve that or optimize the utilization of IVs in your institution.